Hi, we're here today with Terrance Tanner. He is a psychotherapist with Beacon Medical Group Specialties in Mishawaka. Terrance, thanks for joining us today.
Thank you, Heidi. Glad to be here.
So we're here to talk about sleep. Sleep, it's changed a lot during the pandemic for many of us. Trouble falling asleep, trouble with insomnia, staying asleep, and some of it may have to do with that constant news cycle or things that are on our minds. What are you seeing and hearing from your patients? What have you seen and heard since the pandemic started?
I have seen similar issues to what I experienced before the pandemic, just in larger quantities. Troubles with initiating sleep, troubles with sustaining sleep through the night. Those are the common problems that I look at.
And is it things on people's minds? Is it what would they attribute them to? What are some of the things that people talk to you about? And talking it out is important, I'm assuming, in this case as well, when they come to see you.
Certainly, when a person is confused as to what could be causing their difficulties sleeping, they come in to see me. If they have the opportunity to discuss what it is that's bothering them with a spouse or a friend, uh, sometimes that resolves the issue where they develop a plan and they don't worry and they don't wake through the night. But I do see a lot of people that are confused and don't know what is causing their difficulties with sleeping, or it's more complex of a clinical picture than just discussing one's concerns.
What does that take then from your side? How do you handle something like that in your office?
I typically will review what is happening, like if a patient has more than a half hour of time before they're able to fall asleep and they're waking up for more than a half hour through the night, I consider that to be insufficient sleep or abnormal sleep. And at those points, I will offer things like sleep hygiene. And if I do need to take it a step further, I can do the standard protocol for cognitive behavioral therapy for insomnia.
Hmm. So, what advice, like you were saying, that you'll sleep hygiene is important. So, what sort of advice, what sort of sleep hygiene tips would you have for folks who, aren't able to get a full night's sleep right now or are having trouble sleeping?
Well, that's a good question because it can vary depending on a person's situation. Not all sleep hygiene interventions are effective for everyone, but we do want to cover all the bases. So a lot of times I'll just put it out there and see if anything fits for the patients that are coming in. Some of the instructions can include not going to bed with any light on, making sure your room is free of light, and if you have to use a sleep mask if there's no way to avoid that light. Noise, if there's noise that's unavoidable, can you use a white noise device like a fan or some other device that creates white noise? Trying to get a bedtime snack if you go to bed hungry, that can interfere. But there needs to be some discussion about what that is because depending on the food that you're eating, that could be more disruptive. So there's that. There's also a lot with when you're going to bed. Are you going to bed with a comfortable bed? If the bedding is comfortable, if you're free of pain, that needs to be taken care of. The issue with the heat in the room or the coldness of the room is a concern too with sleep hygiene.
How about screens? I mean, many of us are going to sleep with cell phones next to us, TVs on, watching the latest on the news. I know neither of those are very good. Talk about screen time and those limitations before you go to bed.
Well, certainly there's more information coming out about how the blue light spectrum can actually inhibit the production of melatonin. So we do encourage patients to limit the amount of exposure they have to blue light devices or blue screen technology before bed. But then you've brought up an issue that's also very important too, and that is what about taking those devices to bed? Uh, Even if you have a blue light blocker on your phone or your tablet and you take it to bed with you, the bed is still being combined with something stimulating. And we prefer to have our patients go to bed and have the bed reserved for sleep only. That way, your body doesn't learn to be stimulated while you're in bed, but to be more ready for sleep.
Makes a lot of sense. Just need to put that stuff down. Tell me when it is time to come see a professional like yourself. When is sleep so disruptive, or when we're not getting enough sleep? What is that threshold that tells us we should see a professional?
Typically, I will screen for the difficulties that are considered abnormal sleep. And with that, if a patient is getting less than 6 hours, that's something that I would be more concerned about. And if it's taking them more than a half hour to go to sleep, and they're waking up through the night for more than a half hour, then I would think that is maybe putting them outside of the 90% sleep efficiency that we aim for. Um,
And this is, you're saying night after night, right? If I get a bad night's sleep, I don't necessarily have to seek out professional help, but what duration would you say it would be that, again, I should see somebody?
We typically go with a week. If your sleep efficiency is under 90% for an entire week, then at that point we're wanting to assist with
Okay.
some interventions, sleep hygiene, and other cognitive behavioral therapy for sleep.
Sleep's so important. I really thank you for shedding some light on this and for letting us know when it's important to seek help, seek professional help for sleep. So thank you very much. Appreciate it.